Hi, good morning. What happened? Hi, good morning. How are you today? Today is just a continuation of the topic we are on for week 3, comorbidities. It is going to be very quick because we are going to have a third live. So today's one, I just want to touch on just continuing from the one from yesterday's video. Yesterday I touched on vitamins, and I missed out a point. Vitamins are vitamin deficiencies. You can actually go to your doctor, and they do blood tests. They can do blood tests to find out what vitamins are missing. They can then recommend what vitamins you can give to your child who is on the autistic spectrum. It could be maybe they are lacking vitamin D, they're lacking any type of vitamins. Sometimes they could tell you to buy multivitamins from the store, and yeah, so basically you won't miss out on what's needed for your child. Anyway, so today I'm going straight to Fragile X syndrome, and the definition from the Medline Plus. It's Fragile X. I don't know if you have ever heard of that. It's a genetic condition that can happen at the same time as autism. And it's a genetic condition that causes a range of developmental problems, including learning disabilities and cognitive impairment. And it usually affects males or boys more severely than it does females. And affected individuals usually have a delayed development of speech and language by the age of 2. So that could explain why some of our children um, don't have speech and language. Please research into it. It's called Fragile X syndrome. Now I'm going to talk about sleep disorders. Sleep disorders are an additional problem as well, like a co-occurring condition that can happen with autism. Um, Sleep disorder, I'm sure some of you are familiar with this case. I mean, if your child doesn't have problems with sleep, then that's really good. But then some cases, our children do struggle with sleep, and you find yourself up in the hours of the morning or not even going to bed. This can affect your marriage, it can affect your, everything. So you really need to find ways to address sleep problems. So when I talk about sleep problems, we're talking about trouble falling asleep, trouble staying asleep, early morning wake. Some of our children, you find 5 a.m. in the morning, they're up. 3 a.m. in the morning, they're up. Another sleep problem, night terrors. Maybe someone is having nightmares or just having night terrors. Sleepwalking. I've not really encountered that personally, sleepwalking, but I'm sure, some of you may know that someone who does sleepwalk. Then there is also, I just want to address this one, sleeping in the odd position. Some of our autistic children, you know, you may find a situation where they, instead of sleeping flat, they might want to sleep maybe with their head tilted like this, on this like a right angle instead of flat on the pillow. Maybe they don't even like the pillow. Maybe they want to sleep on the sofa and then their head is like this. So now you've got a problem because now that's going to cause problems for your back and your spine. I don't know if you've ever encountered that. Then some children also want to sleep just sleeping like just piling themselves like a hill. So they don't want to sleep flat. They might just want to sleep in the oddest positions that make them comfortable. So these are some of the things that you could try to encourage them to sleep the correct way or show them how to sleep the correct way. Not saying it will work immediately, but you just continue trying. Um, so yeah, sleep problems. They can be, quite. There can be some issues that are concerning when it comes to sleep problems. Um, they may have something to do with let me just read that out to you. Something to do with the abnormalities. I'm going to read the studies have found physiological abnormalities include lower concentration of melatonin or melatonin metabolites in a child with autism compared to controls. So when they're doing the studies, they found that there's low levels of melatonin. So melatonin improves sleep. Melatonin is something that improves sleep. And I'm sure you can get it in some form of uh, supplement. Although when it comes to things like supplements, obviously I'd prefer I would recommend that you approach a medical professional or a biomedical professional or a nutritionist, the people who can really give you the best and safest advice and recommendations. um, so yes, some evidence suggests that melatonin supplements improve sleep patterns in children with autism, but robust high there aren't many studies basically to prove that. Although that's why you will see the difference between the studies available in the medical field versus the studies available in the biomedical field. The medical field tends to have a more dominant, a more powerful impact, I suppose, on society in comparison to the biomedical field and findings, the things that they research. So these ones overpower these ones. So it comes down to you and what your research or what your own conclusions are in terms of your research and what you want to find out, what you want to listen to, or what you want to follow. I'm not telling you to ignore the medical and just follow the biomedical, but I'm just saying at least if you're a person who's open-minded and well researched, you will be able to see where the gaps or make a balance between the medical and the biomedical. It's not exactly the same thing. So, okay. So then, right. So some of the things that can help you to do with sleep problems, to deal with sleep problems, routines. I find like with my children, when they are following a routine, they will sleep very well at night. For example, when it's the school period, we wake up in the morning, get ready for school, go to school, get so exhausted and tired at school, come home, they're tired, they rest, prepare their meals, do other little activities, then bedtime, and they sleep. That way you then have time for you, your partner, and other things that you need to do. But then when it's holiday period, sometimes you might not stick to the routine, but then you'll have to figure out ways to get them tired and, active during the day so that you can get them to sleep at night. But then what happens sometimes, they might sleep in the morning and then at night they don't want to sleep. They're not tired. Or they might sleep in the afternoon and wake up by 7 or 8 p.m. And then they're going to be up and you're going to be up because you can't really leave them on their own. You have to be monitoring what they're doing. So it's nice to just get them into a routine, a balance, even when they're on holidays. That way you can manage their sleep pattern. So that's one way, which personally I find effective. Keeping them active during the day so that they'll sleep at night. Another reason why children might not want to sleep, they might not feel safe in certain spaces. But when you make those certain spaces, or some of the spaces they might prefer, feel more comfortable and safe for them, you will find them willing to sleep in that space as opposed to the other place. My son likes to sleep in a certain place in the house. He doesn't want to sleep in another space in the house. So I won't say exactly which spaces, but I make the space comfortable for him. That way, he once he sleeps, no problem at all, and he'll sleep throughout the night. Another thing you must never, ever, ever do, I would not recommend it basically, is to give your autistic child like fizzy drinks at night. Oh no, 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 no. That can be a recipe for a disaster. Do you know how much sugar is in fizzy drinks? And if you give it to your child who has problems sleeping at night, they're going to be like they're drugged. They're going to be so, and at night you'll see them like so hyper that it's not right. So I would not recommend you giving them high sugar content at the times that they are supposed to go to bed. Chocolates, um, anything sugary, like just try to really minimize or none at all if possible, because there are some things like fizzy drinks. Those are high content of sugar, and those can really cause your child to really like become hyper. They will become restless, really, really restless. So even never give them like a lot. If you're gonna give them maybe a little bit, but not too much, because things like fizzy drinks, that is not. I wouldn't recommend that. Maybe just a normal juice, normal juices, not drink, not a fizzies is it's a recipe for a disaster. That's all I can say. Um, right. So cut out sugar at night time. Try to rid of distractions like loud noises at night, things that will interrupt their sleep, loud music at night, um, TV, computers, and take the gadgets away. Don't leave your child um, on the computer, the tablet, the phone for hours. It is not good for their eyes. It's not good for their brain development, especially if you leave them for long hours. Give them short periods of time to stick to the gadgets for short periods of time. Don't leave your children on gadgets for long periods of time. And I would not recommend the mobile phone for your toddlers, even your young children, because the blue light that comes in your from your mobile phone, your mobile phones, my mobile phone, there's the light is very bright. See it, yeah, it can be very bright for your eyes. So if you don't dim it, to dim it down, dim it for them. That way, if you are going to give them the phone, at least the light is dim and it's not for a long period of time. Or otherwise, just avoid giving it to them at all, because at some point, the more they are on your phone device, especially your smartphones, they're going to have problems with their eyes. And yeah, they will have problems with their eyes, and eventually they'll have to go for eye tests and have glasses, end up wearing glasses by the time they are in primary school. So avoid some of these gadgets if you can, or just give them for short periods of time, or dim the light for your phone, particularly your phone. Dim the lights, because they can cause damage to young children, even to an older person, but especially to younger children who are still developing. So yeah, but at nighttime, just avoid the gadgets so that your children can have time to concentrate and to sleep, basically, without the distractions. A regular bedtime, obviously recommend that. In some cases, behavior therapies can be requested, or you could find out if you can get some support from the people who do behavior therapies, therapists. Right. Clean bedding. Clean bedding. A number of our autistic children, they tend to soil the beds, wet the beds. So you find yourself having to change the bedding every single day. You have to wash, in some cases, the bedding every single day. So this is also something where if the bedding has to be fresh enough for them to sleep. Um, so try to make sure you have enough covers that you could change every time, and then your child is always fresh and comfortable when they go to bed, when they are asleep. That way, they're not itching, they're not scratching, they're just sleeping and just enjoying their sleep. And they will sometimes they might bedwet at night. And in my last video where I talked about bed mats, I recommended using bed mats. You could use the disposable bed mats, or you could use the ones that are sewn, that are waterproof with a waterproof base. And then you could every day you have to change those. If you can afford the disposable ones every day, you could go with that, or you could just do the waterproof, the ones you wash, but you have to change them every day. And because at night, if they wake up and they've wet the bed, that means they're not going to go back to sleep until you change the bedding, or remove the soiled or the wet bed pad and replace it either with a new one or with something else. So those are some of the things that you could do to help with sleep problems. There's another condition co-occurring with autism called reduced NMDA, NMDA receptor function. I'm just going to spell it out like that because I do not know anything about this. It's something to do with the social interactions, locomotor hyperactivity. I'll just say that it's reduced NMDA receptor function. Please go and research on that one because, yeah, I think it's also something to do with self-injury, pre-impulse inhibition, that's PPI, not the PPI we know from COVID, but pre-impulse inhibition deficits, and sensory hypersensitivity. So please research on that one. Tinnitus is another co-occurring condition that can happen at the same time as autism. Tinnitus, I don't know if I'm pronouncing it properly. Tinnitus. When you experience ringing or other noises in one or both of your ears. So sometimes you could hear like a ringing in your ear, but the people outside cannot hear that. It's only you who can hear that. So that's quite disturbing for someone who is autistic. That might just be irritating. Like, why is there something ringing in my ear? On that note, I'm going to talk about autism auditory processing disorder, the hearing, kunzwa, the ear infections, things that happen with our ears. There is in autism, some autistic people have problems with hearing, with the ears, like the auditory processing disorder, the processing of sound. So autism can impact how your child processes sound and noise. Your child may struggle with learning and language because they're having problems processing sound and noise. Audiologists or specialists in autism can suggest strategies to help them cope. Okay. such as hearing aids. So you'll find some people need hearing aids or things that can amplify sound. Auditory and speech training. Some people may need to get speech and auditory training, right? There are also assistive listening devices. I'm sure you've seen, if you go to a special school, some kids have all these things like hearing aids, devices for, all sorts of devices connected to wheelchairs, etc. Hearing devices, you see it all everywhere. Musical training. This one is like musical therapy. This is available in the UK schools, special schools. You find a lot of musical therapy. But music therapy is something you can do at home as well. It doesn't mean you need to have specialist musical therapists. You can do music therapy yourself at home. It's all about trying to engage your child in music, getting their eye contact, trying to sing certain songs, using visuals, or even on TV, you can show them the songs on TV and sing along with them, or try to encourage them to hear the song and sing along. See if they're going to sing along or hum along or make the same tune that they can. So so there's that processing of sound. You see, so it's exchange. It's going around. The sound is coming in, and then it's processing in the brain, and then see if they're going to sing along. So that's all about music therapy. It's kind of like trying to engage their interest, engage their eye contact, see if they're processing the sound and making some tunes. So you're trying to get the response. How are they responding when they listen to songs? Is it helping their sound processing? Is it helping even speech? It's just how their whole response in general. Okay, so I mean, you can look up musical therapy online, and I'm sure you can do some of those things yourself at home. Then there's computer-based tools. Computer-based tools. Then training with a speech pathologist, a speech therapist. So if you have access to speech therapists, I know in Zimbabwe there are some speech therapists. You could also get them to come try to help you. They'll even give you some tools and some information that you can actually try at home with your child. When I was going for speech therapy, speech therapy with with my daughter, with my son actually. Well, both kids anyway. The older one went speech therapy long time. So with my son, so sometimes they would encourage you to do certain games where you do turn taking. There's a whole process that they use. They'll tell you, try this, try that, try this, try that. Sorting toys. You just try different things. So there is information online on speech therapy for autistic kids, and there are other organizations on Facebook that can even give you some tips and tricks to do with speech therapy. That sometimes, if you don't have a speech therapist, you can still get information, and you can still get some of these tools that you can try to do it with your child at home. Okay. Although their hearing may be normal, a child with ASD, that's autism spectrum disorder, may process sound differently than other children. And that's a quote from healthyhearing.com. Sound sensitivity in children with autism. There's something called hyperacusis, a heightened sensitivity to sound. Children with autism may have difficulty processing sound at the same time in other ranges. Some children do well wearing noise cancellation earphones. Right. I once mentioned to you, the headphones that some autistic children wear. Those are noise cancellation earphones, and you can get them on Amazon, eBay. You can get them online. I'm not sure if you're in Zimbabwe, but I'm sure if you go online and just ask someone to send them to you, something like that, and they're easily accessible. If you really need some, you come contact inbox me, and then I can even, you can find something online, and we can make some kind of an arrangement and send them to you. If you really, really need them and you cannot access them, just let me know and we can arrange something. I don't see why you can't access, if you feel that your child should needs that. Noise cancellation earphones. Right. Some children will retreat to a quiet space. So, like I mentioned in the other video, where some children appear to be uncomfortable when there's loud noise. Sometimes it's to do with the processing of sound. It's to do with the problem of processing sound. And so they might retreat to a quiet space, or they might close their ears because they don't want that noise, or they might get upset because of the noise. So some children will tolerate the headphones, the noise cancellation headphones. Other children might not want the headphones. For example, I gave an example of my son. My son has sensitivity in his ears, and he has problems, obviously, processing sound. And sometimes he does not tolerate loud noise. He does not like it. Anytime there's loud noise from the TV, from anyone, even talking on the phone loudly, he will get distressed. He will start to feel agitated. He will start screaming, biting, or not bite, sorry, he starts screaming. He's hitting. He'll start hitting you or hitting somebody, anybody near him. He's just kicking his legs because of the noise that's disturbing him. Right. And yeah, okay. So some kids may be underreactive. They don't react appropriately to sounds in their environment. So some children might not know how to react to certain sounds or to loud noises or sounds in general. They won't even know what are they supposed to do, because they just don't know what they're supposed to do. Okay. So refer to pediatric audiologists or speech and language pathologists, therapists, to help you find the right noise comfort levels. Okay. Now I'm going to talk about ear infections and autism. Now, this one is something that happens a lot as well. This one really, yeah, this one is a strong problem. A lot of our children have ear infections. Let me speak louder. A lot of our children have ear infections, although sometimes they go undetected. So now it takes you, as the parent or the person looking after the child, to check your child's ears. Now I know sometimes sometimes they say that it's wax, earwax, and sometimes it is earwax. But I just want to strongly advise you. Sometimes you need to advocate for your child, because you could have an incident where you take your child to hospital and tell them there's something in your child's ear. You can see there's something in your child's ear. They can see that there's something in your child's ear. And then they try to pull it out, and then they fail. So this is just a scenario. And then they fail to pull it out. And then they just tell you, oh no, it's fine. Just go. Just try putting olive oil. Or eardrops. It's just wax. It will melt, and then it will slip out. And in some cases, sometimes that's a sign to say they don't know how to deal with that issue. They're just leaving it to you, like it's now your problem in another sense. The what I'm going to talk about, it's called otitis. Otitis. It's a middle ear infection. It's something that is quite common in in children with autism. See, the thing about this, it may be difficult for a child to show they are in pain, and sometimes your children are nonverbal, but you'll see them holding their ears, and then you don't understand why they keep on holding their ears every single time they're holding their ears. Sometimes they might just start crying, and you don't know what's wrong. What's wrong? I don't know what's wrong with my child. Then you start wondering. Sometimes it's because there might be an ear infection, and you've seen that there's something in the ear, but the hospital said, you know, it's just wax. Whereas they have not done the adequate tests. There are tests that can be done. There are tests that can be done to actually test the pressure in the ear. So there's a test that can be done to test the pressure in the ear, and there's a test that can be done, which is more of an audio test, an audio type of test, which would be suitable for a child who is verbal. But if a child is not verbal, then I would think that the air pressure test is more suitable. But you'll find that for you to even get to that stage, you are going to have to advocate for your child. You're going to be the one fighting with the doctor. Say, listen, there's something in my child's ear. I want you to do the proper test. So sometimes when the doctors think you don't know, they just leave you. This is a common problem in the United Kingdom, I've found. Sometimes they just leave you. They will leave you. Your children will suffer because, if no one is advocating for the autistic child, then sometimes they are left with the comorbidities undiagnosed or unidentified, and the kids will suffer in silence because they cannot speak. So you should look on your child's body everywhere, see what is anything wrong, and then research it, find out what is this, could it be this, could it be that. Take that to the doctor, say, listen, this thing here, I think I'm suspecting that this is otitis. I'm suspecting this is this. What you gonna? Can you do something about it? Can you do this? It's. I know doctors don't want to be told what to do, but in some cases, if the doctors are not if you don't kind of show that you know what you want, they might not know. They might not even look into it, and then they might leave it. Do you see? I don't know if I'm talking sense. You're not trying to challenge your doctor, but sometimes when you as the parent know something, you're not a doctor, but you still have the power to research, and you still have the power to make what you want known. And then you can have that dialogue with the doctor. Don't be afraid of the doctors. Don't be afraid of the doctors, excuse me. Don't be afraid of the doctors. You know, you just have to have that dialogue in respect, the power sharing, just because the doctor is the one with, on you're going to ask for help, it doesn't mean as a parent you are the weaker person. There should be a power sharing. The doctor must empower you, not to just bully you or something. That is not the right dynamic between a doctor patient relationship. And when the doctor signs up to become a doctor, they take an oath that everything they're going to do will be to protect, there's that oath, the oath of the doctors, to protect the well-being of the patient. So it's only right for them to listen to what you are asking, what you're actually saying. Like, doctor, I think I've been researching, and I believe my child might have this infection in his ear. Could you please look into that? Is it possible for you to do the tympanometry tests, with the eardrum? Because my child is nonverbal, and I think the other audiometry tests might be, because he won't be able to tell us if we can hear the sounds. Could you explain to me about these? Could you tell me a bit more? Or you can just pretend you don't know it, but and just say, doctor, could you tell me what type of tests that can be done, especially my child being nonverbal? So the treatments, anyway, let me just, yeah, all right. The treatment for otitis, it's an antibiotic eardrop or a suctioning device to remove fluids. And obviously your doctor will be the one who will then, after they've done the tests, then they will be able to assist you further and do these treatments or advise you how to do the eardrops, etc. So if they confirm that, yeah, it is an ear infection, it is otitis. Because the problem is, when you leave otitis, the ear infection, the worst case scenario is pain. Pain. Your child will experience pain. And if they're nonverbal, all they'll do is cry. All they'll do is hold their ear and cry because they're experiencing pain. And the worst case scenario is the infection can make a hole in the eardrum. Research what I'm saying. Research what I'm saying and confirm it for yourself. Otitis, worst case scenario, make a hole in your ear, in the eardrum. And that will really, your child will have problems hearing, and come on, the discomfort of that you cannot imagine. What about your nonverbal autistic child? So what I'm saying is very important. So please, one thing I like about in Zimbabwe, the medical field, the doctors are very much independent. The doctors are approachable. You can be free to have these conversations. Whereas in the United Kingdom, some of these conversations are very hard to have with your doctor. You almost go there like, I'm ready to have this conversation with my doctor. And if, it's kind of like you're going there with already a defense mechanism, because sometimes he'll just say, he'll just brush you off. You want to be heard. You want to be advocate for your child. When you have autistic children, you have to be the advocate for your child. Stand up for your child. Stand up for your children. You have to stand up for your children. Anyway, all right. So today, I think that's all for today. I'm gonna come back again on Friday this time, and I'm gonna finish up this topic. And I hope I haven't talked too much. You know me. All right. Thank you so much, and take care. Bye bye.